Okay, Michael. How long have you been a registered nurse?
For almost 4 years.
And why did you become a registered nurse?
Because the profession aligned with everything I really wanted. A flexible schedule, working 3 days a week, directly helping people, has a good amount of science, which I've always been interested in.
Was there anyone that influenced you to become a nurse, or is there any family background in the medical field?
No family background, but there was a nurse practitioner that I met, and she told me about the nursing profession, and that's what made me get initially interested in it.
So did she tell you about the flexible schedule and helping people, and that it was rewarding to her, and that influenced you?
Yes.
Okay.
I remember her specifically mentioning how she was able to walk into a room and help a patient instantly, and how it empowered her.
Okay, so I know you currently work in CBICU. How long have you been a nurse there?
A year and 4 months.
And what's your usual work schedule per week?
I usually I was working overtime, but I recently stopped working overtime, and now I only work 3 days a week.
So it's 3 12-hour shifts?
Yes.
And you work day shift?
Yes.
Okay. As a nurse, have you ever worked any other arrangements like part-time or PRN?
No.
Always full-time on the day shift?
Yes. Well, no. When I first started, I was nights for 3 or 4 months.
Okay. What's the current unit's patient capacity in CBICU?
36 beds.
And how many nurses work on the current floor per shift?
20 to 22, I would say.
Okay, so if there was no scheduling grid or numbers that you have to kind of fit in with the census, what would your ideal numbers or your ideal number of nurses for a fully staffed or a fully bedded unit be, if all 36 beds were full?
I would want, it's 1-to-2 ratios, so that makes it 18. And then you have a charge nurse, and then we have 5 zones. And I feel that a float nurse should be in each zone. So that would be 24?
Not counting the charge or counting the charge?
I think counting the charge.
Okay.
19, 24.
What characteristics or personality traits do you like to see in nurses that you work with?
I like to see someone who is competent. I like to see confidence. I like people who are calm, who have a sense of humor, and are helpful, or offer help.
So just offer help out of their own will?
Yes. Just generally helpful in nature, whether it's knowledge or physical help.
Do you feel like you typically see those characteristics in your colleagues?
I would say 50% of the time.
50%. Can you give an example of someone being competent or confident or just being naturally helpful that you've experienced in maybe the past 2 weeks?
Well, just recently during shift change, one of my patients started spiking a fever, so we had to run a bunch of tests, start some antibiotics. And one of the tests is called a blood culture, and it requires 2 different sticks in 2 different places, and it's time consuming. And during shift change, we're giving a report. Well, this night nurse walked up not even huddle had not even finished yet, and she was like, "Hey, what's going on?" And I told her what was going on, and she said, "Is there anything I can help with?" And I said, "Can you do blood culture?" She said yes, and then she immediately just got everything and started doing it, and it took a lot of stress off of myself because I was team lead in that zone and having to give report and where to go home.
Why do you think that it's only around 50% of people displaying these like helpful characteristics or personality traits?
I think it's some people who have been there for a while are tired of helping others, or they just want to come to work and just have an easy day and not have to do anything extra. And then you have new people who are maybe afraid to offer help, or they're not confident yet in their own practice. I think those are the two major ones.
So what do you think like leads the other half of the staff to kind of act opposite?
I think that there's a sweet zone for most ICU nurses. And I think the other 50% are in that sweet zone where they feel still happy working there. They feel like it's meaningful, and they're passionate about it. And so they come to work and they're going to give 100% and above. And I think that's about the other 50%.
Do you think that people who have been there longer are able to join that group?
I think they can definitely join it, but will they join it? I think depends on how they feel that day and what's going on.
I guess a better way to put that is, do you experience people who have been there longer actively engaging?
No.
At all?
Very little. I would say maybe if I had to put it in a number, maybe 10 to 20%. I would maybe go more towards 10%.
Okay. Ideally, how would you say that nurses should support one another?
I think showing up and being in a general good attitude is helpful. I think oftentimes when I come to work, I feel stressed and nervous. And whenever I can show up and like other people are happy, or they're in a general good attitude, ready to start the day, that helps ease my anxiety. And then I think that as the day progresses, that they should be helpful during the shift. And by helpful, I mean, when they have downtime, they offer their assistance. And they should be confident or competent in their skills. So I don't want to work with another nurse who doesn't study or actively seek out learning opportunities. And so I want to work with people who know they're always learning and refreshing the nursing practice and what it applies to in CVICU.
How often do you see that ideal happening? Where people are we can take the first thing that you said first, where people are coming in with a positive attitude. How frequent is that?
30%.
Okay. And why would you like to see that? I mean, obviously you would like to see that number increase.
Mm-hmm.
Why? Other than it putting you in a good mood whenever other people are.
I think that if the majority is displaying a certain characteristic, that others are likely to fall into place. That would be a major benefit, because if everyone's ready to go and happy to be there, then other people who may have showed up sad or over it, they're going to whip into shape and be like, okay, everyone's going to be good. I'm not alone.
Mm-hmm.
I got to be here anyway, so let's get it done.
And what sort of like chain reactions would that bring throughout the shift?
I think it would make the day go by a lot easier and less stressful. I think it would be a chain reaction all the way into the end of the shift, and just a whole culture change on the unit.
How would that translate to like patient care or certain like safety standards?
To quote Glee, being a part of something special makes you feel special. And so if people think that they work in a place that's special, they're going to seek out more opportunities to maintain a gold standard, whether that's doing audits for central lines and Foley's, or going above and beyond for patient care, mobilizing patients. They're going to go that extra step, knowing that they work in a place where people are happy, and it'll eventually end up helping everything that you would want to help in a nursing unit regarding quality and data and safety.
Okay. What issues or details do you experience nurses comparing with one another?
Say that question again.
So like what issues or details do nurses compare themselves based on? Like if I'm a nurse and I'm comparing myself to another nurse, what am I doing that on the basis of?
Years of experience. It's hard. I don't know what the words to say to put it into. I guess it takes a while to learn it, but someone's culture, the work culture, or their work ethic, I guess is what I'm trying to say. So, and then obviously, like if their team, if I'm coming to work every day and they team lead a lot, or they take all the devices, they're taking devices often, they're charging, stuff like that. They're ahead of a committee. That's how I kind of compare what I would consider. Am I comparing them to myself, or?
Yeah, I mean, whether it's you comparing yourself to others or just your experience of nurses comparing themselves to someone in an external situation.
Yeah. Well, in CVICU, I think it's the way they compare each other. The people who care to compare each other to themselves is years of experience. What devices are you taking? Are you certified? Are you in any extra activities like charge nursing or team leading or satisfaction committees?
Is there ever anything that's like a little bit more superficial that they compare themselves based on?
Maybe initial attitudes.
Okay. What are the thoughts and feelings that you consider whenever you think about whether to help another nurse?
I'm going to go back to the last question.
Okay.
Tardiness is a big one. How you show up and like present yourself. I will initially judge you on that.
So you think that nurses compare themselves to others based on how
professional appearance and timeliness.
Okay.
Okay, say the next question again.
Yeah, what are the thoughts and feelings that you consider whenever you think about helping another nurse?
Whenever I know there's a new nurse on the unit, I tend to seek them out more if they need help. And then I think it also depends on how I feel that day as well, how stressful my patient assignment is, or if I'm tired or worked a lot of days. But if I feel good that day, then it's really just me wanting to be helpful. My motivating thoughts are just, it'll make me feel better to help other people who might be struggling. But whether I'm having a good day or bad day, I usually tend to seek out, if I know a nurse is newer, or maybe this is the first time they've taken a heart device, then I will go find them and make sure that they don't have any issues.
And what like motivates you to seek out the newer nurses?
I just feel I always have had a passion for education, and I feel like I can explain and help in a certain way that doesn't come off as political or me trying to be arrogant or come off like I know my stuff in front of someone new. I generally feel like I remember being new and how nervous and unsure I felt, and so those kind of things come over me, I guess, and I want to go help them.
Okay.
And I have a mutual interest in helping new people. I want them to be competent. I don't want someone just to slide by and then they're 2 years into their practice and they still can't manage difficult patients.
So other than like wanting to help a newer nurse, when are you most willing to help any nurse?
I'm willing to help any nurse. Okay, let me rephrase. I'm willing to help most nurses when I have available time. So whether I'm actively seeking out to help someone or someone comes up to me saying I need your help, I will always be like, okay, if I have the time, if I'm doing something I have to take care of first, I just communicate that. Or I offer someone else that may be able to help them.
Okay. So say that you do have the time to help someone and they came and asked you, what are some tasks that you're most willing to do for them?
Anything. There's not really one that I wouldn't take care of. I guess I would base it on priority. Or sometimes what I'll do is I'll take care of something mundane for them so they can take care of a priority. So, or if they're really having difficulty with, sometimes it's family members, I'll offer to go do something for like a difficult family dynamic. What I mean by that is if someone is very watchful over their loved one who's in the hospital and they cause a lot of stress just from being watched, sometimes I'll offer to go in and do something.
And why do you think that you like kind of gravitate to those either mundane or familial tasks?
I mean, I don't really know. I guess I just kind of ask what they would like me to do. And if they can't answer me, then I pick a task for them. I feel like, for a newer nurse, for example, if they have something that's a priority, maybe their patient is hypotensive, but the other patient that they have has to go to the bathroom. I want them to go take care of their hypotension so they can learn, and I'll go take care of the bathroom situation. I guess that would be I want them to learn. I would have them take more of a learning thing so I can take care of something else that's simple.
Okay. What about like if another nurse in your area receives an admission, what are some things that you're going to be helping them with during that admission?
I always go for two things, and that's to put the chest tubes on the ground and connect them to suction, and I will get the IV pole organized. Lately, actually, I've been more comfortable doing their assessments and charting their lying drains and airways. And then I sometimes offer suggestions or recommendations on what they should call the doctor to ask for, but I really try to be conservative with that because I don't want to tell them how to manage their patients.
Okay. When are you least willing to help another nurse?
I'm least willing to help a nurse who I know has an assignment that they can control. So if I'm working with a veteran nurse and they don't come up and ask me for help, I most likely won't go help them unless I have absolutely nothing else to do or anyone else lower than them that would maybe need more help, like a new nurse. Also, um, there are one or two nurses on the unit who I don't want to say refuse to help, because I will help if they beg me, but I feel like my license and my practice is at risk helping them, and that's why I don't want to help them. I don't want to put my name on anything they're doing, because I'm not sure that they're doing a safe practice.
So that's coming from like, you feel like the way that they're managing their patients would affect you if something grave happened and they were to be investigated or something?
Yes.
Okay. What are some like tasks that you're least willing to do if you do help these people?
Least willing to do?
Mm-hmm.
I won't. I don't really. What do I do? I don't think there's nothing that I wouldn't do. I guess I would only do like one or two things for them.
Or what about
I feel like.
Sorry, go ahead.
I guess I wouldn't. I wouldn't call an advanced provider, or I wouldn't complete a task that requires some assessment or information from them, because I feel like I wouldn't get a correct assessment or correct information, and therefore I would need it to complete the task. Like if I called a doctor for them to say this patient is this situation is going on, I'm going to recommend this. I feel like I would have to do everything myself before I did that, and that's kind of hard to do when you're just walking in and helping someone.
So if your workload has to be like drastically increased and you have to get all sorts of background information in order to complete the final task, you just don't have time to do that.
Yeah.
Okay, what about if like it's a nurse who you are willing to help? Are there any other things that you kind of try to actively avoid?
I guess they're charting. I won't chart for them unless I do the assessment or I know what I'm charting. That's really the only thing.
Is it like specific charting? Because you said that you will sometimes chart like the output and stuff during an admission.
Well, that's because I do that. I do that assessment part physically, and then I do the charting. Like if they ask me, can you chart the 11 o'clock vitals and it's now 3 o'clock, I'm not going to do that because I wasn't there.
Okay.
If I can't physically assess it, then I'm not going to do it for charting.
Have there been any instances where you thought about helping another nurse and then refrained?
Every day.
Do you have like an example?
I always think about helping nurses, but sometimes you offer help. You don't want to offer help when they don't want help, because that'll close communication and cause friction. So, that's when I will not help someone.
Okay, but do you think that there's like unspoken gestures or mannerisms that people kind of display that exhibit a need for help that people are able to pick up on?
Yeah.
Even though they don't like explicitly ask?
Yeah.
Do you still hold back from helping during those times?
No, but what I'll do is I'll be really broad, and I usually kind of let them pick whether they want the help or not.
Okay.
But I'll start very broad. Is there anything I can help with? Or you look really stressed. Is there anything I can do for you so you can take care of something else? Stuff like that.
Okay. In what situations do you like to receive help from other nurses?
I like to receive help when I want to do multiple things at once, and I can tell them an exact thing that I want done. I know that they know how to do, And so I'll delegate that. And I've gotten better at it as the years have gone on. Instead, I would just be like, oh, this patient's crashing, or, oh, I'm just really busy. And now I say, yes, can you do this?
And like, what are the thoughts and feelings that you have whenever you think about like receiving that help, or you do accept the help?
So at first, and I still battle with this, but I feel incompetent and like I can't do my job when I ask for help.
Mm-hmm.
And I think that's part of I think that's part of an ICU culture. It's like an old dog eat dog kind of cliquey kind of thing that still kind of lingers. And I think it's also just comes from I'm very self-motivated. And so when I feel like I can't do something, I always feel like a sense of failure. But obviously that's not rational thinking. And I know nurses that don't think like that. So I've actually gotten better, and I don't feel my self-doubts and negative feelings no longer really interfere with my ability to ask for help.
But do you think that they still sometimes prevent you from accepting help? Or is there anything else that might prevent you from accepting help?
I mean, I won't accept help from someone who I don't think is competent to do it. Help is only helpful when it's helpful.
Yeah.
So that will prevent me from accepting help. So if they come in and offer help, I'm going to be like, no, I'm good. So that would be another one. But also, if I want to learn something or I want to handle something by myself, then I will say, no, I'm good, because I learn best hands-on and doing something myself. And so if they come in and want to do it for me, then that's not going to help me. So I will decline that. But I may say, can you do this instead with the other patient?
Okay. So I know we have like team leads and sometimes float nurses on the floor. Mm-hmm. Do you feel more comfortable asking those people for help rather than like maybe your neighbor?
Yes. And I would say only the float nurses. I don't really like asking a team lead for help because they're just as busy as us. And it really doesn't make any sense why they would be more available to help us. If anything, the team leads are more busy because they're usually the nurses who take the complicated patients because they've been there the longest.
Mm-hmm.
So only the float nurses.
And that's just because they're more available?
Yes.
So what if there's...
Well, they're literally the ones who have no patience and are meant to be helpful.
What if there's only one for the whole floor? Would you still try to seek them out first?
I would, unless I know they're busy. And I just give them a call and just say, hey, are you busy? And if they say yes, then I'll say, never mind. And then I'll go down a chain. So my chain would be, I guess my next chain would be team lead or my neighbor.
Mm-hmm.
And then, of course, the nurse assistants.
Do you think that your familiarity with another nurse impacts your decision to ask them for help?
If I know a nurse well, more of like on a friend level, then I will ask them for help in more mundane ways. So I'll be more comfortable going up to a friend at work if I want to, like, let's just say I want to clean my patient's back, look at their butt, and put on skin protecting interventions. I will be more comfortable going to a friend and asking that than I would someone who I don't know as well.
Why do you think that is?
Because that's me being super extra, and I don't necessarily always have to be extra, and I don't necessarily need my friend to do that. I can always call the nurse assistant. But if I know they're working, then I think that I guess what motivates me is when I'm working with a friend who I know is a good nurse, then we can go that extra mile and provide that patient care. And then she's actually going to involve herself and actually help me and be like, oh yeah, we could do this, we could do that. And we're actually going to have a more fun time than we would if I had just And I feel like other people might kind of get annoyed with me if they're busy and I'm asking them for something mundane where I can call someone else for that.
Mm-hmm. So, do you think that it's like knowing them better, or is it them having a better clinical practice?
Just knowing them better.
Does knowing that someone has a better clinical practice affect, like, if you had two people next to you and you know that one of them treats their patients better, you would ask them to help you first?
Oh, absolutely. So if I know a nurse, I'm not necessarily friends with them, but I know that they actively participate in like wound prevention committees or infection control committees, then I'll absolutely go to them and be like, hey, I want to do this. Because I know that they're going to be like, oh yeah, let's go do it.
Do you think do you think that that's like a characteristic of them, or just the type of person that they are, or have they learned that over the years?
I think it's a blend of all of it. So I think a personality plays a big part of it, and their kind of passion for what they do. Because there's people who are always going to work at a minimum level. That's why we have minimum standards. And they want to live in that minimum standard area. But there's other people who want to be a little bit higher and exceed. And I think that goes along with their personality, and maybe years they've worked there, their confidence gets higher, so they can start branching out to specialties like that.
So then, what would you say is like the cutoff, where they, like, the amount of years that you've been there? At what point do the nurses stop wanting to be helpful and kind of become reclusive into not wanting to help anybody?
I don't think I can answer that in years. I think it's because there are nurses that have been there for years and they're still helpful. I think that they are. I think that if someone's happy to work there, they're still helpful. So if someone is tired of being there and they are annoyed that there's still work there, but they choose to stay there, that's whenever I start to see a shutdown. Yeah, that's how I would answer that question.
Okay. That's the last official question. The last one is just to let us know the participants better. So can you tell me your age, sex, and ethnicity?
30, male, and white.
And your highest academic qualification?
I guess a graduate student or bachelor's in nursing.
A BSN?
Yeah.
Okay. Any final thoughts or things you'd like to add?
No.
Okay. Thank you.
You're welcome.